This is a message from Prof Dr. Paleswan Joshi Lakhey for Behind White Coats. She writes, "Thank you, Behind White Coats, for inviting me to say something in this podcast on women in surgery. At the outset, let me remind you that I am a daughter, a sister, daughter-in-law, sister-in-law, wife and a mother of 2 lovely daughters, and a surgeon striving for excellence in every aspect of life. In my journey as a surgeon, there were many occasions of unconscious bias from my surroundings, identity crises, failures, and success. But the thought of giving up my dream of becoming a surgeon never came to me. I just held on to my dream, believing in myself, trying to be confident, and surrounding myself with people who I thought always supported me. I always made sure that I knew my limitations early in my journey. Besides my career as an academic surgeon, my family has always been my priority. Having said that, I've learned to prioritize things, doing the right thing at the right time to intricately balance my family and my career. To all the young aspirants in our future, have the courage to dream, be proficient in terms of skill, knowledge, and attitude. Be confident about yourself, fake it till you feel it. Believe in yourself. Always remember, no one accomplishes anything alone. Know your limitations and your strengths. Learn to prioritize things in life, doing the right thing at the right time. Everything will fall into its place if you have the confidence, perseverance, and courage. I still believe noble effort is merit, which has been my motto since my school days. My best wishes and blessings to you all. Paleswan Joshi Lakhey, Professor and Head of Department of GI and General Surgery, Maharajganj Medical Campus, Institute of Medicine, Consultant GI and Hepatobiliary Surgeon, Tribhuvan University Teaching Hospital.
Hello everyone, I'm Manita.
And I'm Prarthana.
Hope all of you are doing well, and I wish good health to you and your family as well. Time has been challenging, but we are finding ways to cope with this. Hope this gets over soon and we'll get back to our normal schedule.
Yes, and it's been a long time since we've done this podcast because the times were difficult and we also had our own study commitments to fulfill. So we are back again. And so today we'll be discussing a topic which we hold very close to our hearts. It is going to be women in surgery, and discussing this in 2021 would seem like a very surprising thing, or should have been a very surprising thing. But unfortunately, we are still here, still talking about this because the problem itself is not solved, and there are many challenges that we as women are going to face in the future as well. So it would be better that we be aware of them and work on towards how to improve them. And I think everyone needs to be educated of this, regardless of their gender, every medical student studying. So hope that you all will get a few insights from our discussion, Juanita.
Yes, right. Like as you said, even in 2021, we find this topic quite relatable. Obviously, this is not a new topic, and women have been advocating about this in such a long time. They had their own struggles back then, but even now, if we think, we are still struggling. There are different challenges. We still find it quite relatable even to talk about in this time as well. So yes, we'll be talking about women in surgery. You just said that this is something very close to our heart as well, right? And personally knowing you and your future interest as well, I know this holds a different place in your heart as well. Maybe you could share like why there is this special place for this topic in your heart.
Okay, so first of all, being unbiased, to say that I'm a female, right? So this topic is of much more of a personal significance for me as well, and an aspiring student in surgery as well. So women in surgery would be very relevant to me and to everyone out there. But we say that the world is full of inequalities, and there are many disparities that needs to be taken into account. And this is one agenda that we see in medicine. Few can justify it based on their personal experiences. Few would like to justify it based on the researches that they have done, or the evidence that they have brought out regarding the disparities. But mostly, I learned from stories, or I've heard from stories, as to how a woman progresses and what a woman feels who is in a surgical field. So while we are advocating about women in science, technology, particularly in the STEM field, we need to talk about women in surgery as well. And what seems pretty fascinating to me is that we have read the quote in anatomy as well, that we say that to be a surgeon, you need the eyes of the eagle, the heart of the lion, and the hands like a woman. But it's quite surprising to see that surgery itself is a more of a male-dominated field rather than a women-dominated field. And to be honest, much of the work needs to be done in women in surgery, and many people are not aware of this as well. So in order to raise voices or to make people understand, I think I hold a special place, because it is important for us to be educated about the disparities, even the minor disparities that we see, because a zero tolerance needs to be applied if we need to bring a change. And nothing can be held accountable if we are not aware that that is happening to us. So it's very important to talk about this topic. And the thing that I mentioned before, like women in surgery, I'm a woman who is aspiring to be a surgeon. So it's very important to me, and hope we'll unravel many aspects of this in the discussion further.
Very true, Pratna. And even for me, I can relate to most of the things that you said. Being a woman myself, I can relate to this. Even though I don't aspire to be a surgeon, I don't know if what has fate for me, but then what I can't tolerate is there is a place that has been created by the society, and the line, the way that you need to walk. When we see that we are girls, and there are certain fields that has already been designed for us, and surgery is not one of them, and I can't tolerate this fact. I remember you sharing one incident with me where even one of the teacher, he told one of our friends how she being a female, she might go into obs gynae, not even considering her option or not even trying to listen to what she has to say. Right, it's not only about fighting your own insecurities, but also the prejudice of the society that they have set for us.
I'd like to point out an interesting fact here. So it's not only, it does not only show that the amount of gender inclusion in a certain specialty would amount to equity. So this is a funny fact that whenever we think about OBGYN or obstetrics and gynecology, we readily think that it's a very women-dominated field, right? So there are much less of men going into OBGYN, and so maybe there is much more of an equity there. So maybe the voices of women are heard more in that field rather than any other surgical fields. However, it would be interesting to note that obviously when I looked up or did research for this podcast for women in surgery, I could not find any data related to Nepal, which is very sad because that topic is not of interest still in Nepal. However, what I saw from the American data was that even though OBGYN is a very, very female-dominated field, only five women have become the president of the OBGYN Society, and rest of the all presidents were male. And above that, almost 50 to 55% women in that field report being sexually harassed. Problems are complex and numbers might not signify equality. So this is what I'd like to mention here. And I think whenever we discuss these things, we need to see how the history shaped medicine and how it shaped the surgical field, because what discourages a woman from not going into surgery is obviously the long working hours and the decreased work-life balance and decreased family time, which holds a pretty near place in a woman's heart. And it's the peak of her reproductive years, it's the peak of her personal life, her family life, but she really needs to spend that into that gruesome residency or the gruesome practice that surgery field entails. So maybe that is the reason that many women don't choose it. But we really need to dissect out as to how this field evolved and what women had been doing before us 200, 500 years ago, and where have we reached now. And so I think that would be pretty interesting to understand.
Right. In the history of women in surgery, I think you can elaborate it perfectly than me. But what I remember reading is one of the first women surgeons, she was practicing in the disguise of a male, right? Only after her death that she was known to be a female. So that was pretty sad.
Yes, you're very true, Manita. She was Dr. James Barry, and she went out to fight the Battle of Waterloo, the Crimean War that took place, the wars, the big wars that we learn about even in social studies. I remember in grade 9, Napoleon Bonaparte, he was, kind of defeated in the Battle of Waterloo. And she was a well-admired person. She really took care of the wounded soldiers, did her surgery very, very well. But she was only respected because she was disguised as a male. So everyone thought that she was Dr. James Barry, who was a male. And whenever the army found out that she was a woman, that is after her death, it was a matter of shame to them. So she was not celebrated as a woman, and she was buried as a man. So even they knew that she was a woman, she was buried as a man. So we see how the history has shaped. However, it was interesting to know that women had a much bigger role in surgery during the 3500 BC era of the Sumerians and the Babylonians. They had a much bigger role in our part of the world. In 400 AD, when Taraka wrote his book, The Father of Surgery, we call it, women were performing surgery in our part of the world. But what really went downhill was during the Middle Ages, when the church put out the regulation limiting the practice of women, limiting them to apothecaries and to midwiferys. And then women faced a lot of challenge in doing or practicing medicine, after which they were confined to home. And in the 1800s only, the France government gave the legal advice that the women could inherit their husband's surgical practice after the husband's death. So if the husband is alive, they are not allowed to do it, but they can be registered surgeon, and if their husband dies, then they can inherit it. So this was how resistance was slowly developed. There wasn't a resistance before, but the resistance developed in the Middle Ages, in the Europe, and then I think it has been ever since, sometimes due to our personal bias or sometimes due to the system, but the resistance is still not gone. Obviously, there were a lot of challenges. The Royal College of Surgeons did not, or tried to pass a law not to take any female surgeons or certify any female medical student to become a doctor. However, many people fought, and at least as of now, women, if they consider to go into surgery, despite a lot of challenges, they can without any resistance. So yes, I think we have come far, but we need to know that it was not the same before. Things were much better, and then it got worse, and now we need to do a lot of work to make it better. I feel that way.
As you said, we have come a long way. I don't exactly know the data of South Asia or this part of the world, but in America, almost about more than half of the medical students had started being female, right? So that might be one good change, but there is still a long way to go when it comes to choosing the specialty, because of different challenges, like you mentioned about her commitments to family life, to her children. I was watching one video by one of these surgeons, and then she so beautifully mentioned that we tend to call surgery a male-dominated specialty, but it is more accurate to call it a specialty where the number of men is more, but it is definitely not dominated by male. So I found this statement quite fascinating and very interesting as well. Maybe if we start thinking like this, some of the prejudice that we already have, like this is a male-dominated specialty, and how am I going to survive this? For someone who has never even felt comfortable in their own skin or comfortable talking to other people. Putting her in a field where she will be surrounded by males might be quite frightening at first. But then we have to understand that it's not male dominated. You just have to find a space there, and then you'll be fine at the end.
Very true, Manita. Like, if we can shift the narrative from it being a male dominated field to being a field in which more males are present as of now, then I think it can shift a whole new perspective. The reasons why women might not choose to enter into surgery is numerous. And one thing that we need to talk about is implicit bias, I think. So before we go into all of the external biases like the family life and the stuff that happens, I think that every one of us has an implicit bias as to, we believe, even you believe, even I believe, that I'm much more caring than males, or I'm much more, fragile. I can feel emotions better. So that's the implicit bias that we have towards ourselves. And this implicit bias might influence so many people to, kind of, I think in one way how this can play a role is during the intake. If you get an interview for the surgical residency, and if your program director has an implicit bias that he or she does not know of, and you are there, you talk in your own genuine way, like, soft, kind, humble, and then you kind of say what you want to say, and then some of the male applicant comes in, he goes like in a more dominated way, in a more strong, in a confident way, then even if you might have been much more eligible to be in that field rather than that male counterpart, it's not the bias of like the explicit bias that is seen, that they favor males over females, but the program director might allow the male to come in. And sometimes they're even confused as to why in my residency there are no females and how come this disbalance came up. So before preparing for this podcast as well, I wanted to do an implicit bias test. So if anyone who's interested in listening to this podcast as well, even you should do it, Manita, because this was a test that was designed by Harvard psychologists. And it shows that if we have any implicit bias, but we truly believe we don't have any, I think it kind of like highlights that we have an implicit bias in some way. So how the test goes is, I'm not going to explain how the test goes, so you can take it. Maybe we can link it in the YouTube video as well. But I chose the field of science versus gender. So the science could contain like the liberal science and the science. So the hardcore science, which is maths, geology, astronomy, physics, chemistry, biology, and the liberal science, like the philosophy, the history, the arts kind of stuff. So they basically try to sense the timing in which you sort things out into the two different groups, that is the gender ones and the science ones. So they give you something and then you need to sort it out into liberal science or science, and science versus gender, science, gender versus liberal science. So it's more of like a complex thing. I don't think I explained it properly. So if you took the test, you would understand it. So basically they calculate your reaction time as to how fast you sort things out. And that is how the implicit bias plays out. And I found today, which was very surprising to me, that I had a slight belief that men were more associated with science and women more with liberal science. It was a slight association. I don't know how it happened, but I was surprised. And if I even ask you, Manita, it might not be true, but to close your eyes and really, really think of a great scientist who shaped the world or the course of our history, probably the image that flashes in your head might be a male rather than a female. So maybe we do have implicit bias because our history does not have much of a woman representation.
What I'm sure of is I do have that implicit bias that you just talked about. We have been reading stories about this, hearing and watching about all the great things that men have been doing. And what we have seen is female are mostly within the walls taking care of the families. Even though I don't want to admit this, subconsciously somewhere I know that even this is the way that I have been maybe training my mind. I don't know if this is the right word, but then yeah, I feel that I do have that implicit bias. Now I know we have talked about this before as well, but I want to share this here as well. um I'm someone who got quite fortunate enough to be in a school where I was taught that being a lady, I can rule the world. Because I had a good role model. See, the principal of our school, she really did her best to make us feel that we are wanted in the society, that we have a role to play, and we have much more to do than what we are said to have. And I was living in this world. Maybe it was a sort of my dream world where I'd always believed that I'll be given equal importance and the equal place as any other male that I'll ever encounter. So it had just been few months, almost about 6 7 months, that I've started seeing those subtle signs and then realizing that the world that I live in is not the world that I think I live in. So it has kind of been very frustrating and very challenging for me to get this thing in my head, to consider that I really need to work harder than most of my counterparts, even though I might be more qualified than them in some aspects. um, I'll have to work harder for the same place than a male counterpart. And I have seen subtle signs and the subtle microaggressions in the word myself. And for the first time, I realized that I was quite heartbroken. But now I do talk about this with many of my friends. If I have to go into surgery, maybe this is also something that will stop me in a field where there are already more men than females. I will have to fight extra hard. I don't know. I have to give, even if I give my 100%, I might not be able to get the position that some of others will be getting easily, right? So this might be one thing. And maybe we can talk about other challenges like how family commitments and long years of practice or that residency years also influence the choice of women.
Manita, so I very well resonate with your story as well. And, you know, like we are sitting here discussing from a place of privilege, as I call it, because we have been able to explore this topic as well. And which is very, very, you know, we should feel ourselves privileged enough to do that, that we are discussing on this thing. And what you say, I resonate because 12 years of my life has been passed in a girls' school, and there was no other gender to intermingle into my world, at least. And there was no gender roles basically when I went there. And I was doing also mechanical work, which maybe as of now, more of the technical stuffs are attributed to males. So one thing is like shifting desks and benches from the ground floor to the third floor, which might seem like a daunting task for a fragile built female, as how the world would like to call it. Maybe like I don't know, because after I came to co-ed, I see that that is heavily influenced by male friends, even though it is a small thing to talk. But many people suddenly assume that this is not the task of females, or they would not do it, and rather we need to tell the males to do it. Obviously that task is not much of, you know, like interest, like carrying benches and stuff, but being able to do everything was the world that I lived in, right? So there was not even a single task which I thought I could not do if I put my mind to it. And then I came into this co-ed setting. And Monita, what you mentioned, that you had a female principal and she made, you know, like everything sure that you were taken well care of, and you were pointed towards, or showed that you can do anything if you put your mind to. So I also was under the leadership of a female principal. So we always talked about women empowerment and, what girls can add much more to the society. So we had someone to look up to, right? And female mentorship, that's a huge, huge issue in surgery as well, that many a times a woman who enters into the surgical field, she might be only the female resident under a male surgery head, and then she does not have anyone to look up to as a female mentor. So most of the mentorship relationship that she forms would be towards a male. And the data might be objective to quote, but however, it's the experiences that we read that holds much more of a value than the data, I believe. So many women find themselves isolated, or the mentorship relationship between their male surgical residents and the head and the female surgical residents and the head to be much more disbalanced. And some have even reported, almost around 10% have reported sexual harassment and many different things. So obviously that dynamic comes into play. We cannot negate that. And apart from that, she has found herself very, very behind in informal networking as well. So I remember that I personally have a very wonderful mentor who propelled me into neurosurgery, to be honest. And I'm always inspired by him. So he has mentioned anecdotes of women not being invited into these parties or football games or the hangouts that happen within the surgical residency outside the hospital. And many a times women needs to hang out with their wives. And though she is a surgical resident herself, equal to them, she might not be felt included enough in that informal networking group. And this hampers a lot of dynamics or learning as well. And many a times women drop out, so they leave if their pregnancy happens. So this is the data that can be seen in surgery. So whatever we talk about, it actually prevalent in Nepal. No one has assessed it. It is definitely, if we talk to a female surgeon, she'd be able to tell us better. But so these are the things that hampers a woman, that she does not have a role model to look up to, which we had during our school years. And I don't quite believe we have that role model in medical school as well, Manita, and that I'm very sure.
I don't know if it's rational to point this thing over here or not, but when you're mentioning about pregnancy, I just happen to remember one incident. It's not something that I went personally, but some friends of mine, they were narrating that incident to me. It was the first day of the residency. And Professor over there, he so blatantly told one of the female residents that if you're planning for pregnancy during this residency year, you should opt out of the residency on your own. Like, you don't have a place for this. Or you should not even plan about this, wait 3 more years. So I don't know, but what I had always in my mind is motherhood is something that you have to get to choose, like when you want to do it or when you don't want to do it. And it's also a decision of a male and a female, right? Both husband and wife. And if wife has to opt out of residency, it's because of pregnancy. Does that man also has to go through the same? I don't think that's something of a concern to a teacher or to the professor who will be guiding them or mentoring them. But when it comes to female, they have to choose between a family and a career. And some subspecialty of surgery, like even neurosurgery, I think it has long years of training, almost about 7 years, as far as I know. And that is very crucial. Like, as you said, it is the peak of reproductive years, right? And sometimes you have to choose between having a family or whether you want a family or not, whether you want children or not. Because I know a story of a female surgeon who spent her most fertile period training, and now she can't bear a child because she's not fertile anymore. And she has been advocating about this, advocating about letting women be a mother during the residency years as well, or even if they decide to do it in medical school, everyone has to be positive about this.
Manita, whatever I heard is very, very sad. And I think many of us, even right now, being in 2021, being a medical student, consider the motherhood thing if we want to choose surgical residency. And even if it is really our passion, many of us might give up on our dreams after we pass out. Or maybe if we enter, we might be forced to leave. So we don't know how things are going to turn out, but this is very sad, and I attribute all of this probably to the lack of female leadership or female representation in the places where the decisions are being made regarding the working hours, regarding the pregnancy leave, regarding the curriculum or the grueling training that surgical residency has to offer. So we can see, right, like when females come into leadership, many things drastically change, like the shared parenting and the leave that is granted to the father as well as the mother in New Zealand. And I think that is a very, very inclusive model of female. So the voices of female are not represented, not at all in medicine, to be honest, because all of the heads of all of the society, be it internal medicine, be it neurosurgery, be it any other field, be it surgery, the head of the departments or the head of the societies are mostly male. And there might not be women in the executive body, or only few of them in order to raise the voice regarding this. And there are many solutions that the world has opted, but I don't know about the pregnancy leave here in Nepal. How many days? I think it's 45 days as far as I know. WHO recommends that a pregnant woman should rest almost 6 weeks or more in order to, probably it's around 3 months. She needs to rest, and that's the health guideline. However, our surgical residency gives a much more of a lesser leave than WHO recommends. And to bounce back from that leave is also very difficult for women. And we talk of the glass ceiling, right? So if we say that the glass ceiling does not exist, then someone needs to actually break that glass ceiling so that it shatters down and then there is no glass ceiling anymore. So women find it very difficult to bounce back. Even if they come back, they might not receive much of the support that they have been receiving. They might not get adequate training. They might be presented, or they might be perceived as being much more disinterested, uncommitted, and not so passionate enough as their male counterparts, just because they decided to take a leave, which they lawfully deserve because it's a human right. Motherhood is a human right. So these are the factors that come into play when we think about this. And the UK suggests trainings like less than full-time trainings, which women can receive if they are in their surgical residency. However, this can compromise their competence as well. So this is not a good model, like telling the woman to choose less than full-time training, and then during their motherhood period, or if they're during their pregnancy, and then like whenever assessing the competency, saying that women are much less competent. So the blame is not to be put on the woman, but probably the system. So we need to reconsider this thing. When I was reading about this topic, I also found out that, I mentioned it in my posts a few days ago as well, like glorifying the hustle. So if you want to be equal, you need to hustle twice or thrice as hard. Like if you want to stay at the top, if you are a female, rather than being a male, So we cannot say that we are equal, and if we work equally hard, we would get equal results. Yeah. A female has much more of a challenge to overcome. That the racetrack where it was blocked by so many obstacles, whereas the racetrack for the males was much more open. Even if it has obstacles, we cannot say like it does not have, but it can be a small or easier thing to navigate rather than the females, which had this big roadblocks in the way. So, many a times our society says be a do-it-all. Like you can be a good mother, you can be career-oriented woman. You can stay at the top of your career. You can be a very good mother. You can parent your children well. But now is the time to question, like, why should we be the ones to do it all? Because the children are equal responsibility of the father as well as the mother. So shared parenting needs to be advocated very, very well. And I was going to mention that because the hustle is so glorified into our system, our women are too afraid to be seen as incompetent in their careers, which can adversely affect their careers as compared to male counterparts who take the holiday. That women were seen to practice during their first trimester when they were suffering from severe nausea and vomiting as well. And during the third trimester in the early stages of labor, they were performing the minor surgeries. And this is very, very sad. And I think the system has failed. We need to reconsider this. We need to bring this topic into conversation much more in Nepal. And the female surgeons here can guide the way.
So there are many challenges, and I don't even know if we have addressed all of them. But what I know is if a woman become a surgeon, she's definitely going to be one hell of that amazing person that you'll want to meet and you want to get treated by, right? So yeah, I want to talk about um, opportunities as a women surgeon as well. Like, what are the good things that can happen, how a patient can benefit, and how the system can benefit as a whole. From the accounts that I've read, even from the patient's account, they feel very comfortable when there is a woman surgeon. There can be instances when they might question their competency, but once you go and meet them, there has been accounts of how they have been treated well and how empathetic those surgeons were, how they took their time to discuss the treatment plan with them, how they took their time to explain the procedure and everything. Maybe it's because of the all the qualities, all the implicit bias that we talked before, but that can also have a positive impact on a patient life. So yes, that was all I was talking about, how being a woman surgeon can benefit the whole system altogether.
That is very true, Manita. And we talk about microaggressions in the surgical field. I think that's much more less in women as compared to men. And women are inherently found to be much more empathetic. And that is a huge value that medicine holds account to, that being empathetic is very important. So that is the phrase every medical student around the world has heard, like putting yourself in the patient's shoe. So when empathy is such a virtue or value thing in medicine, there's no doubt that women would be able to handle the patient well. Women can be beautiful surgeons, but what I truly believe is 10 years, 50 years down the line, I've read a quote that there will no more be female leaders and there'll only be leaders. So hopefully 50 years down the line, we don't need to discuss female surgeons and we'll just be, whenever surgery flashes in our head, we don't need to imagine like a young or, like an old man or a young man who's like, like well built and strong and muscular, and he kind of like does surgery. Because many a times I try to imagine, whenever I close my eyes as well, I see very few women in the operating room, and that's sad because I can't see an operating room where there's all women, or I can't see an operating room where there is a balance of male and women. But whenever I imagine the operating rooms, that is the picture that comes is based on what I have seen, or what is usually projected out. It's always like a male dominated field where the male surgeon is doing an operation. So hopefully this narrative will slowly be changed. And I would also like to mention the academic field of surgery, like the professor, associate professor, assistant professor. Whenever we talk about them, many of the times the professors are males, right? So whenever we think about professors, we think about old, gray-haired people with brown coats, with glasses which has no
Yeah.
rim for me, at least, like the smart ones, and
Yeah.
they're like reading books or doing something, like someone we portray as intellectual. Many of them have gray hairs, but we never think of a woman as a professor many a times. So that's very true as well, that only 12% of the females in surgical field go out to be professors. So academic medicine is a whole different entity in itself rather than the clinical medicine, that is the surgery that we do in our day-to-day practice, and the academic field where we focus more on advancing the field through researches and stuff like that. So there are much less female researchers. The research grants are not awarded to females many a times. There is no conference scholarship for them. Even there was an anecdote that I read that a female surgeon presented in a conference, and then there was a male surgeon. And the judge announced that they had a tie. However, the award was given to the male surgeon. Now, I don't know what explains this, but academic medicine, because it is of my interest as well, we really need to evaluate our surroundings as well. We need to be wary because we don't tend to pay a lot of attention to these stuffs. We are only, so much engrossed in our syllabus. We don't think about who teaches the syllabus, or, many a times the things that we care about, we need to observe it in our surroundings as well, like if you want to change it. And for me, this has been a huge, huge backlash to see that I don't find many female professors. Actually, I have not seen one, I think. I'm just contemplating that I've not seen a female professor. And to be honest, the professorship is almost like a gateway to leadership in surgical societies. So it clearly explains why females are not represented, why their needs and voices are not being taken into account, and why the change has still not come. So it's a dynamic field that we have sat to discuss on, and we might find a lot of pathways, like branching pathways. There won't be a conclusion. So maybe many times we only discuss the problems and not the solutions. But yes, no one actually knows the cause as to why this is happening, and how can we increase the representation of women more.
Yeah, Prarthana, what I'm thinking, like when we have leadership like you and many other girls who are trying to go into surgery and who aspire to become a surgeon, I really would like to request them to not be influenced by any other biases, any other prejudice, the limitations of the society, or I don't know what there can be, what other challenges there can be, but please don't get um, distracted by those, and please go into this field. It's not important that every woman go into becoming a surgeon, because it's also about your interest. If every woman start becoming a surgeon, we will start having underrepresentation in other fields, right? But if you really aspire to do so, you must go into this. And then I really believe that with the change that we're seeing, like we have started seeing women in surgery. We have started seeing women pushing themselves into the leadership positions. And then when we have girls like you, women like the women that you'll become, I know things will change for sure. And I'm already so happy about this, already excited about this.
Thank you so much, first of all. So I think it's the collective responsibility of every one of us. It's not just, females, particularly our male classmates as well. I think it's the collective responsibility. This topic is not exclusive only to females, because if you're talking of a problem here, then that problem is the only problem and not a gender specific problem. So many genders. I say it because there's not a binary gender here. We need to talk about that, and that's a different entity. However, that each individual has to consider this as their problem. And even as of now, whenever we talk to friends, we definitely see, like in orthopedic surgery, I've heard of an anecdote where a resident dropped out because she found out that it was too gruesome to perform orthopedic surgery. I don't know what is the reason. And many a times, even we as classmates now discuss that we would not choose surgery because of the fact that it would be very difficult for us to balance our family life and professional life. When we know that we have not even tried it out, you see that maybe we have heard those anecdotes from, I don't know, so many other people who might not be female as well. So we need to consider that as well. Like many of them might have said that surgery is challenging for females, but have they actually felt that? We really need to consider that into account, and the only way is to go forward no matter what. And as I said, obviously we are not fortunate enough to be in an equitable system where we are seen as equal. I can truly say that because we really need to hustle 4 times hard to break that glass ceiling if we need to be seen as equal. We need to fight for that place. We have experienced it as medical students in minor amounts. I want to point out that the discrimination against women, or the discrimination that they face as medical students, as their early life careers and as their midlife careers, is much more bigger in their midlife than in their early life. So I don't know how many discriminations or how many disparities, even though we don't know it's right, we need to face it because of the system in the years to come. So if someone's going into surgery, the only way is for them to be educated about this disparity, identify it when it comes, and not succumb to it.
Yeah.
I think that is the only solution as of now. Many women need to go into policy making level where they drive the policy in the surgery field or any other field, be it OBGYN. If there is no women representation, women need to go there. Be it any other surgical societies, be it internal medicine, be it dermatology, be it, because I can truly say that there are no female representations, or there's very little less in these societies, even though the numbers are high in any specialty. So we need to do that. And yes, the only way is to drool through the past, like take out the hurdles as of now and throw them away in whatever small way you can. If you're able to incorporate change, then I think we can see a better future for other medical students. That's all I have to say.
Yes. And like, to whoever listening to this or watching this, I believe in you. You have clicked this link, decided to listen about this topic, and think about this. And what I know for sure is you're going to be that change maker we are talking about, and you're going to make difference, whether be it you're a girl or you're a boy. As we talked earlier as well, it's a collective effort that is needed. It's the responsibility of each one of us to make this system better. If there are less representation of women, I think it is a disadvantage for men as well, because it's when we talk about making a system better, we need both. We're never saying that we want the whole system to be built or created by women, right? We know the importance of having an equitable place, and we know how all of us, if we work together, we can contribute it better. So each one of you, I believe in you, and I really hope that we'll be able to make a system that's more considerate, and the future generation that will come, I believe that we'll leave a better world than what we got.
Very, very true, Manita. Like Malala puts it in a good way. I came through this quote when I was in grade 12, I think, that none of us can move forward if half of us are held back. So if we want to propel our world in a much more better direction, we need to be inclusive of 100% of the humanity that's present and not just 50% of them. And I really hope, yes, we do have female surgeons to look up to in Nepal. We have a Women in Surgery initiative. We have Dr. Paleswan, who is a GI surgeon who has been inspiring so many girls. And we leave a short message from her as well. And I know that message is going to inspire many of us. So thank you, ma'am, for being an inspiring figure to look for women or female medical graduates to look up to here in Nepal. And I really believe that after this discussion, whenever thought of pursuing surgery comes into our mind, we decide to pursue it no matter what. And later in the years, we'll have good mentorship, good scholarship opportunities, good research grants, good research mentorship, less grueling hours of residency, more considerate system taking into account the female physiology of even menstruation, even pregnancy, even motherhood. And many women will be in leadership positions to gear this system into a better and more equitable and much more of a functioning and advancing department. And the goal of all that is to touch patients' lives in a much more better way, and the healthcare system and the surgical outcomes will be much more better if we can tackle all of these problems in surgery. So it was an insightful discussion, Manita. I think we're running pretty late. I don't know how many minutes or hours it's been that we've been talking.
It has definitely been insightful, at least for me. Though the whole objective of this conversation was to see the conversation among us and to see how we can contribute to advocating about this topic and then bringing this forward to everyone's attention. And I think we have been able to do this. We also did a quick Instagram survey a few days back, and I'm so thankful to everyone who responded. And even through that survey, I could see how people has been positive about this, how women and men equally, they consider surgery to be a specialty for women as well. And I'm very thankful to all of your responses as well. We are very thankful to all of your responses. Thank you for your support. Here we'd like to take a leave. Prarthana, any last message that you'd like to leave?
The last message that I'd like to leave from my side would be that from now, we would be much more cautious of the discrimination that we are going to face in our medical education through a gender perspective. Not only our female classmates or female medical students, but even the male medical students, they need to be considered enough. Try reading about this topic if you want to build a much more equitable system and identify those micro discriminations, microaggressions, the inequalities that we see, and try to call them out or rectify it, even through a small way that you can. And I think that collectively we can make this happen. And we'll see many female mentors. And whenever we close our eyes, we'll see an equitable operating theater with men and women working hand in hand, performing surgery, and the patients are much more happier and the outcomes are really good. So this is my final message on.
Everyone, here we leave. Thank you for listening. I hope you had a good time. Stay healthy. Take care of you and your family. Bye-bye.
Bye. Stay safe, everyone.